I'm in a procedure room at Phoebe Gastroenterology with Dr. Franklin Goldwire. I know you do all sorts of advanced procedures in here, but I'm guessing what you do most often is a colonoscopy. Explain what a colonoscopy is and why it's important.
So a colonoscopy is a procedure where we take a flexible tube with a camera, and that allows us to go in and take a look in someone's colon to see if we could identify any polyps or cancer in early staging.
Well, when should we begin those regular screenings for colon cancer?
So we should begin regular screenings for colon cancer around age 45, unless there are some other risk factors that put you at increased risk of developing colon cancer.
So what might some of those risk factors be? Who should consider getting a colonoscopy a little earlier?
Sure. So patients who should receive colonoscopy earlier are going to be patients with a family history of colon cancer. So if your relatives have had an episode of colon cancer, we recommend you get screened at age 40. And if you have underlying chronic gastrointestinal issues such as inflammatory bowel disease, you should also get screened earlier for colon cancer.
Now, are there screening options in addition to a colonoscopy?
Sure, there are. So there's the Cologuard test, which actually looks for DNA changes in your stool to help you identify if there's colon cancer or advanced polyps. Then there's FIT testing, which actually kind of looks for blood in the stool, which helps you to identify patients who may be at increased risk.
So what are kind of the pros and cons? How do you decide which screening option is best for you?
So those non-colonoscopy screening tests are going to be for people who are at average risk without any prior history of colon polyps. So that's that population. But anyone that has a family history or has had a prior colonoscopy in which colon polyps were identified, then they should be screened using a colonoscopy.
So when we talk about a colonoscopy and people think about the preparation part of it, it kind of can scare them off a little bit. It's not the most pleasant thing in the world, but it's not nearly as bad as people might think, is it?
No, it's not. I think there's a lot of patients begin to psych themselves up, dreading what is about to come. But, we prepare our patients well, and we give them a diet to adhere to, and also provide them a bowel prep that's suitable for them. So that way it helps lower the anxiety about the upcoming preparation they're going to undergo. And the main thing is just follow your instructions as prescribed by your provider, so that way he can get a nice clean colon, so that way he can do a really good job of screening and making sure there's nothing there.
And that prep that you drink doesn't taste nearly as bad as in the old days, right?
Not as bad as the old days, absolutely.
Are there symptoms of colon cancer that we should be watching out for?
So there are some symptoms of colon cancer, but unfortunately, those symptoms tend to occur with more advanced disease. Okay? So when you start to have abdominal pain or change in stool caliber or blood in your stool associated with colon cancer, that means it's probably more advanced. So we recommend that before you even notice or start having symptoms, that you come in to get screened sooner.
Other than getting screened when our doctor recommends it, are there other things we should be doing to try to prevent colon cancer?
Sure, there are some risks, lifestyle modification things that we can do. One of those is smoking. We know that smoking increases your risk of colon cancer, and excessive alcohol can also increase your risk of colon cancer. So just altering some of those lifestyle modification things will help.
So the rates of colon cancer in the United States have been going down pretty steadily for 20 years or so. That's obviously good news. What do you think's behind that?
So I think there's two things. I want awareness and then access. So doing programs like this brings awareness about colon cancer. And then now here in the Phoebe, we have several doctors in the area that can allow us to increase the number of patients that have access to screening colonoscopies.
Well, it's proof that works. So if you need to schedule a screening colonoscopy, you can call Phoebe Gastroenterology at 312-0698.